So my first annual report as Chief Medical Officer is really wanting to start a conversation with the medical professionals across Scotland. I've put to them a lot of questions about how we practice medicine today in a really changing time. Medicine has changed, our treatments have changed, and our doctor-patient relationships have changed. So I'd really want to hear from the medical professionals across Scotland, set up questions from shared decision-making with patients to looking at how we're treating people and how we're doing that for the best outcomes. So I'd really like to hear from all our medical professionals across Scotland, medical students, junior doctors, right up to senior consultants. I want to hear their views. They're the ones that are practicing medicine in today's world. Our real aim is to improve outcomes for our patients and our people across Scotland. And as the leaders in healthcare, as part of the bigger team in the NHS, I really want our doctors to help me to do that in Scottish Government. Well, I hear from the doctors across Scotland as I've been to visit that they really are finding the pressure of volume of patients, numbers of people coming through. People are iller when they're arriving in hospital, and our increasing number of older people mean that there's a lot more work to do. I'd like to start a conversation about realistic medicine. This is medicine that is giving people a chance not to do everything possible, but perhaps to talk about what's important to them, to really share decision making with their doctors. I'm hearing from doctors that sometimes they feel they need to operate, they need to give treatment or chemotherapy because they feel they have to. They feel they can't have a conversation that this may not be the best thing to do. But in fact, maybe less medicine is better. It's better for people's quality of life, and it's probably what a lot of people would like to do. Doctors themselves would do less at the end of their own lives than they would offer their patients because they understand the side effects, and maybe quality of life is more important. So I think that we've changed the doctor-patient relationship over the last few decades immeasurably. Patients are now our partners in decision making. My conversation with doctors across Scotland is how to make that even better. How do we quantify risks? How do we quantify the benefit versus the risk for various treatments? These are difficult, the statistics are difficult to interpret for anybody, but perhaps we can start to talk about these decisions differently so that everyone is clear at the end what the best outcome would be for that individual or their family. I think our public health messages across Scotland are really trying to take hold. We have the lowest ever rate of tobacco smoking at 20% of our population. Traditionally, it's been the most deprived communities have smoked more, but in fact, the rate in most deprived communities has fallen even more than the rate across Scotland. So that's very good news. The other pieces of good news are that our young people are both smoking less and drinking a lot less alcohol than they were even 5 or 10 years ago. So our messages about healthy lifestyle are coming through. The other thing we're really starting to talk about is increased physical activity. We know that this increases people's health as well as their emotional and well-being, makes them feel better, reduces depression, and can reduce the rate of dementia, diabetes and cardiovascular disease. We've had less mortality overall in Scotland because our healthcare system is dealing better and better with people's chronic illnesses. So we'll have a microsite, which is a website for open comment. I have my email address, my own account on Twitter. I am very happy for people to contact me in whatever way they would like to.